Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, President Rodrigo Duterte warns unvaccinated people that they can be restrained or arrested for violating stay-at-home orders. As COVID-19 cases rapidly increase, more areas are now placed under alert level 3. And is it the flu or Omicron variant? An expert tells us the difference. And what are some home care steps to take when infected? Infectious diseases expert Dr. Ong Lim joins us live. President Rodrigo Duterte warns that unvaccinated people can be restrained if they will violate stay-at-home orders. Mr. Duterte adds that barangay officials can also arrest unvaccinated violators if they will continue to endanger public safety. Here's the president in his own words.
I'm now giving orders to the barangay captain to look for those persons who are not vaccinated and just would request them or order them, if you may, to stay put. And if he refuses, then the barangay captain, being a personal authority, is empowered now to arrest the recalcitrant persons. That is in addition to the police power, the agents of a person in authority.
Okay, 14 more areas are now placed under the stricter alert level 3 due to increasing COVID-19 cases. Malacanang says the cities of Dagupan, Santiago, Olongapo, Angeles, Naga, Iloilo, Lapu-Lapu, Lucena, and Baguio will be under alert level 3 until January 15. The provinces of Cagayan, Bataan, Pampanga, Zambales, and Batangas are also placed under alert level 3. Meantime, the country has detected 29 new Omicron cases, bringing the total number to 43. The health department has yet to declare community transmission of the highly transmissible variant. So what happens when COVID-19 hits home? Let's go straight to the source of the story. We have infectious diseases expert, Dr. Ong Lim, and we'd like to invite you to please join our discussion today. Send us your comments and questions on our Facebook Live or Twitter account. Dr. Ong Lim, good to see you again and welcome to the show. Happy New Year to you.
Happy New Year, Pinky.
Okay, I just want to go first. Let's look at an overview of the number of cases. Yesterday, we recorded 17,220 cases, a positivity rate of almost 37%. Basically, it means almost 4 out of every 10 persons tested actually turn out positive. I hope I'm correct with that evaluation. And the second thing I'd like to bring up is, are you expecting the numbers to get worse?
Based on what we've seen from other countries, Pinky, this is likely to go up even more in the next few days before we actually expect a decrease to happen. Hopefully, following the pattern of other countries in a few weeks.
Okay. What is your projection? Are you looking at a number where we will be peaking?
Yes, no, unfortunately, because based on experience from other countries, what has been seen is a needle-like increase in the number of cases. And then as more and more of the population become infected, and hopefully with vaccination catching up, then we will have more of the population being protected as well.
Okay, what is your projection in terms of numbers? How high will we go? What is the peak?
Nako. Well, there are projections being shared by the DOH Faster team, but I don't know whether it's the variables are changing so quickly, no, Pinky. Kaya I don't think it's fair to be able to say ito na yung hinahabol nating numbers.
Okay, I understand. That's fair. All right. Ang importante naman ho dito are many other things, no, such as understanding the virus and, of course, hospital capacity. So I know that we know right now that the DOH is still not declaring community transmission of the Omicron variant, although they're saying that they are already assuming this. But let's just go back because numbers can scare or bring about fear among people. Are you looking at the numbers on the infected go higher than what we've experienced during the Delta surge?
Yes, definitely, no. Kasi behavior from other countries has shown that to be the experience. So, ang saving grace lang talaga, Pinky, is that most of the cases are mild. Pero ang medyo nakaka-concern talaga sa situation natin ngayon is that lahat ng tao apektado, including healthcare workers. So, kung ang inaasahan natin ay yung ating medical staff nandiyan para tulungan tayo kung meron mang mga severe or critical cases or even moderate cases na kailangang ma-ospital, it's the healthcare system infrastructure that is in danger of collapsing because the people might not be able to help us because they're also sick.
True. And that has been proven because even in hospitals, they're saying that a number of their staff or their personnel have been infected with the virus. That's why I was saying hospital capacity. I forgot to mention that the staff in the hospital is also one of the bigger factors that need to be considered. One thing I saw, though, very recently is that the WHO was saying, let's not call this mild. Let's just call this is not as severe, but they do not want to categorize this as mild. Would you agree?
Well, yes, because people do have a tendency to gloss over diseases that we call as mild eh. Pero syempre ayaw nga natin binabaliwala ng mga tao itong infection na to because there are people who get the more severe forms of the disease. And if you are elderly or you have comorbidities or if you're on the extremes of age, you're younger, you're an infant, this disease can be quite significant for you as well.
Let's understand Omicron, Dr. Ong Lim. So there was a statement and an explanation made by Father Austriaco. Ang sabi niya, this could be the beginning of the end of the virus, but we need to be cautious. Basically, in summary, he's saying that this could actually serve as a natural vaccine. He explains it na if you survive, you will get the antibodies that will protect you not only against Omicron, but all the others such as Delta, Gamma, Beta, Alpha, etc. Do you agree that this could be the beginning of the end, but we need to be cautious?
So Pinky, I think his statement is coming from this really small study of 15 patients or 15 samples demonstrating a cross protection between Omicron and Delta. So to be fair, walang nakasulat doon na it protects against the other VOCs, no? Pero encouraging yung cross protection that Omicron has versus Delta. Now, to say that this will be the beginning of the end assumes that the VOCs that will come along will also be able to or Omicron will also be able to protect against any other future VOCs, which really with this virus, it's so tricky. We don't know what's going to happen next.
In fact, that was actually my follow-up question. If that is true, but let's lay the premise, as you mentioned a while ago, it's a small sample. Assuming it is true, my next question is, how do we know that this can actually protect us, if true, from other mutations or other variants? Alam naman po natin from Delta to Omicron, I believe, if my memory serves me right, there's 50 mutations and about 32 in the spike protein. What's going to tell us that there could be more mutations larger than 50 and more mutations in the spike protein larger than 32?
The short answer is we don't know, no? I mean, nobody ever thought that this kind of variant where you have so many mutations would even come up, no? So I think the message really is to focus on the fact that the less transmission we have, the less variation we expect to happen. So ang goal natin actually is to stop transmission para hindi na magkaroon ng bago pang variants.
Okay. So what we need to do right now is still, of course, to vaccinate and to get your boosters. But we'll take a very short break. Dr. Anna Ong Lim will have you, I think, fix your camera. We will be right back, and we will be asking the practical questions and what to do at home when one is infected or one is exposed, what tests to take, and when to take it. We will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, infectious diseases expert, Dr. Anna Ong Lim. Dr. Lim, we already have questions, no, but I want to start with this because it's also top of mind for me. Omicron versus the regular flu. How can one actually tell the difference between the two?
It's very hard, Pinky, because the overlap between symptoms is quite significant. No, so you expect fever, you expect body aches and pains, cough and colds. The only way you can possibly test is use a PCR or antigen, and also to think about what happened in the background of that patient. Kung yung mga kasama niya puro COVID, the more likely diagnosis is also COVID for this patient.
So is there anything distinct about Omicron that is different from the flu?
Well, it seems that we're not hearing as much of the anosmia that's being described earlier. I don't know if you noticed that. No, that hasn't really been mentioned by many people. But then maybe it's also because the symptoms are so short-lived. Parang mas mabilis din mag-recover yung mga tao.
Totoo ba yun, Dr. Lim, na mas mabilis talagang recovery with this virus?
Well, it seems like it, particularly for those people who have mild symptoms. No? Parang lumalabas sa kanila, mabilis-bilis lang pagka nagkaroon sila ng cough and cold illness, they recover. Lalo siguro for vaccinated. That's actually one of the problems, right? The people who are vaccinated, they tend to think, ay, siguro it's just an itchy throat or I'm having allergies. And before they know it, they've infected somebody else. And because that other person is unvaccinated or vulnerable, nagkaroon ng severe illness, saka na lang maiisip, ay parang ako yata yung nagkaroon ng sakit a couple of days ahead.
Doon ka na nagbabacktrack eh. However, malamig din ho kasi yung panahon ngayon, di ho ba? At dahil malamig yung panahon, there's a tendency na magkasipon ka o magkaroon ka ng itchy throat. In fact, let's be honest, when you find out that someone that you know or somebody close to you has been exposed, potentially exposed, all of a sudden, we suddenly become very sensitive on how we're feeling. Parang bigla na lang minsan sabi mo, parang makati na rin yung lalamunan ko.
That's so true, no? And I know all of us have experienced that. But I guess the thing that's really working to establish a diagnosis of COVID is really the fact that we're exposed. Ang dami kasi natin nakakasamang may sakit. So kung may possibility that you had somebody in your home or workplace who got sick, then think COVID first before anything else, lalo na if it's a respiratory illness.
So assume COVID.
Assuming COVID, then the first thing you really need to do is isolate so you don't infect other people, and then find a way to get tested.
Okay. This is where it becomes a little bit tricky, and I'll admit, even for me. Let's refresh our memory on the protocols, what needs to be done, etc. I'm going to start with a question from Twitter. Sabi, most confusing, when someone in the household has been exposed to someone outside, for example, your coworker who tested positive. By the time the exposure is confirmed, the household member has been regularly interacting for a day or two already, maybe even 3 because of the backlog on the results of the tests. Ako na po nagdagdag nun. What should the exposed member do if there are no symptoms?
Okay, so it's a really common scenario, di ba? Kaya natin sinasabi, yung may sakit really needs to isolate right away. Kasi yung pag-isolate na yon will save the household or the workplace forward transmission for at least a couple of days. Kasi all the interactions with the sick individual are now protected. So ang hahabulin na lang nung cluster na yon will be sino ba yung na-expose nitong taong to 2 days before the symptoms started kasi nakakahawa ka na. So
2 days before the symptoms started?
That's right. For whatever
I see.
type of whatever type of COVID virus, you're already infectious 2 days before your symptoms start.
Wow,
So
okay.
kaya kailangan na once you get any symptom, isolate para yung forward transmission mo na-cut na. Yung backwards na lang ang ititrace mo.
Pero ang hirap din no, Dr. Ana, kasi 2 days before the symptoms because your telltale sign is the symptoms.
Correct. Kaya nga, sana lahat ng interactions mo mask. So kung masipag ka talaga mag-mask at lahat ng interactions mo outside your home are protected, ang kailangan mo na lang problemahin yung what do you call this, yung mga kasama mo sa bahay. Kasi
Sa
hindi ka naman
bahay.
nagmamask sa loob ng bahay.
Opo. Okay, so I want to go to this for some people who may have questions on what to do. No, this is coming from the DOH website. I actually pulled this out from our correspondent Caroline Bonkin. She has this on her Instagram account. This is also good for those who might not know what to do because sometimes medyo nagugulat tayo pag nalaman natin merong exposed. Please help us out here. I want to put up, if we can put up that graph, no? So it says symptomatic, result, reading, and action. So let's start with symptomatic. Yung symptomatic po, pag nag-antigen test positive, ang reading is highly positive, isolate immediately. Tama po yun.
That's right.
Okay.
So
let's
Pinky,
stick to
siguro
the...
yung point, sorry. I
Go
think
ahead.
the point to make is an antigen test positive result is highly reliable. So paniwalaan natin kung positive siya, pero kung negative, kailangan i-confirm.
Okay. Punta muna tayo dun sa positive na highly likely, ano? Do you still suggest that that positive antigen person still undergo a PCR or hindi na po kailangan?
For practical purposes, for management of the person, hindi na siya kailangan. Now, kailan helpful ang PCR? Alam natin na sometimes kailangan natin ng some kind of reimbursement and currently PhilHealth only accept PCR positive as confirmatory. Sa hospital setting, uulitin yan kasi kailangan natin ng documentation. For severe cases or atypical cases, uulitin din yan. And because we need samples for whole genome sequencing to establish what's happening in the community, kailangan natin ng some people to still do RT-PCR.
Okay. So, nandun na po tayo sa bahay, sa isang household may nag-positive na antigen. So, isolate nyo na siya. How many days must that person isolate and when does day 1 begin?
Okay. So, isolate is the word that we use for people who are sick or who are positive. And whether they have symptoms or not, they have to isolate for 10 days para hindi na sila makapanghawa ng iba pang tao.
When does day 1 begin of the isolation? Nung found out na positive siya sa antigen?
That's right. So bale,
Okay.
for those with symptoms, you count from the day of onset of symptoms. So let's say today, nagkaroon ako ng symptoms. So I isolate today. Today is January 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17 ako lalabas. 18 ako lalabas the day after.
Okay. Lalabas ka on the 11th day. Now, here's the
Yes.
question on that. What if you're still symptomatic? What if you still have a cold on the 10th day and pwede ka nang lumabas on the 11th day? Can you get out of isolation? Should you get out of isolation?
So that's a good question. Ang assumption doon, dapat totally well ka na for at least 3 days.
And what if you're not?
Extend ka. Typically, may plus 3 days. So yung original WHO guidelines, ang sinasabi nila talaga, 10 days of isolation plus 3 more days without symptoms. So it's
I
actually
see.
closer to 14 than anything else.
Opo. Kumbaga, swerte ka kapag 3 araw, within the 10 days, in the last 3 days, wala kang symptoms, safe ka na. Otherwise, you stick to 14 days. Okay, I just want to do a follow-up on this. For those exposed doon sa antigen positive, pero nag-negative po sila sa antigen. So meron po sa household nag-antigen positive and there, let's say, 5 other people in the house, nag-antigen sila, negative sila. Are they free to go, or must they isolate, or must they undergo an RT-PCR? Because here from the DOH, I'm reading that you should quarantine first and test with RT-PCR on day 5 after exposure.
Okay. So, let's use the correct terms. Tama yung quarantine because quarantine is applied to the close contacts of the sick person. The purpose of quarantine is to observe for onset of symptoms kasi, again, 2 days before the onset of those symptoms, you're already contagious. So ayaw na nating manghawa ka pa ng iba because it's very likely na meron kang infection. So you are quarantined for 7 days if you're vaccinated, for 14 days if you're unvaccinated. And whether or not you do a PCR or an antigen doesn't make a difference. Whether you're positive or not, it doesn't make a difference. You continue with that period that's been assigned.
Okay, let's summarize that again. For those close contacts, it doesn't matter if you do an antigen or an RT-PCR. You must quarantine for 7 days.
Yes, vaccinated.
If you, fully vaccinated po yan. For not fully
Correct.
vaccinated or unvaccinated, 14 days. So within the
Yes.
7 days, Dr. Ana, you have no, let's do 2 scenarios. You have no symptoms. Pwede ka na lumabas on the 8th day.
Correct.
What if you
And
have
if you-
symptoms?
Okay, the count resets. Now you are shifting to isolation for 10 days. So
Got it.
the
Okay.
whole point of this, so it's tricky, di ba? Oo, but let's just think about it this way. Your goal is to stop spreading your virus. You don't want to share what you have, right? And the reason why we isolate people who are sick is to try to contain their movements within that period where they're contagious. So, saan scenario ka man nanggaling, once nagkaroon ka na ng simptomas, ilang araw ka ba contagious? Yun lang naman ang kailangan sagutin di ba? And that's 10 days. It's a very simple answer. Now, if you don't have symptoms but you're positive, ang assumption natin, 10 araw. So, isolate ka rin. Now, yung quarantine is really just to try to catch those people who might be already starting to replicate the virus in their systems. And since we never know who that is, then it makes sense to keep those people who have the highest chance of infection from moving around and sharing whatever they have also. So that's the household members who quarantine for 7 or 14 days depending on their status.
Depending if you are vaccinated or unvaccinated. We need to take a very short break. The source will be right back. All right, here's a question, Dr. Ana Ong Lim, or a comment from Marie. Tanong ko, bakit mga kaibigan at relatives ko naka-2 jabs na at marami naka-booster pero infected pa rin? 2 of them are even critical. Bakit daw may ganon?
It's a very good question, no? Let's remember that vaccines are supposed to protect against the risk of severe disease and death. So the fact that people are being infected should not be surprising to us kasi hindi naman pinapangako ng mga bakuna na hindi ka na mahawaan. Pero significantly bababa yung risk nung again, I said, severe disease and death. Na yun nabanggit ng ating viewer na meron siyang relative na nasa hospital at medyo critical ang kalagayan. Unfortunately, hindi rin 100% yung reduction ng risk or reduction ng risk of death. Kasi meron pa ring patient factors that have to be considered. If you're frail, you're elderly, you have significant comorbidities, you're immunocompromised, medyo mahirap naman umasa na lang tayo dun sa bala kung yung sundalo ng katawan natin hindi naman makatulong.
All right. Here's also another question from a friend. What should one do at home or prepare at home if somebody is antigen positive? Dito na ho ba, kailangan ho bang uminom ng gamot such as paracetamol? Kailangan ho bang uminom ng antibiotics? And yung isa pa, should they get molnupiravir?
Okay. So siguro let's talk about the home remedies first, no? Hindi naman natin kailangan pangunahan uminom ng mga kung ano-anong gamot kung wala pa tayong nararamdaman. So those are symptomatic treatments. You wait until you feel the symptoms before you take your paracetamol, your cough medications. There's very good data on Lagundi, so they can take that if they're having distressing cough. So symptomatic remedies are actually all that we recommend for now for people who get infected. But molnupiravir or all these other outpatient antivirals or medications for COVID are really for very specific indications. If you are high risk for progression to severe or critical disease, but you are not yet sick enough to be hospitalized, your doctor may prescribe these drugs for you to try to prevent progression.
Pasensya na kayo, Dr. Ana, but some people might want to just do it on their own because is it bad if somebody actually takes, for example, molnupiravir? What I read is that it's good for mild symptoms, but it must be taken, please correct me if I'm wrong, at the early part of your infection.
That's right. No, so it's an antiviral. The studies that have been conducted show best effect if the symptoms are still mild to moderate, and these are the impact or the benefit is shown specifically for people with high risk of progression to severe illness. So very specific group. Is it bad? Well, syempre kung hindi resetado, we always want the medical evaluation. Access is also not easy, no? Kasi these are drugs under an EUA, so they can only be obtained by prescription.
All right. So just an advice to all those watching us right now.
So I think the most important thing to remember at this particular point, no, in the COVID crisis is that we haven't ever had a VOC that transmits this fast. So kaya tayo nauunahan. And if there's one message people need to remember is once you start feeling something, isolate. Then you do all the next steps. What we want to be able to do is to contain spread. And that spread can happen as quickly as 2 days from the time that you start feeling your symptoms. And so isolating, once you feel something, will prevent people from your home or your workplace, decrease the risk of getting something else from you.
Dr. Ana Ong Lim, maraming salamat po sa inyo.
Thank you.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.